Personality disorders are enduring patterns of behavior, thoughts, and emotions that deviate markedly from the expectations of the individual's culture. These patterns are inflexible and pervasive across many situations, leading to significant distress or impairment in personal, social, and occupational functioning. While everyone exhibits traits that may align with various personality types, individuals with personality disorders display these traits to an extreme degree. These conditions often manifest in adolescence or early adulthood and can persist throughout a person's life. Diagnosing personality disorders can be complex, as it requires a thorough assessment by a qualified mental health professional who can differentiate between normal personality traits and those that have become dysfunctional. There are three main clusters of personality disorders: Cluster A, Cluster B, and Cluster C. Cluster A includes disorders characterized by odd or eccentric behaviors, while Cluster B encompasses disorders related to dramatic, emotional, or erratic behaviors. Cluster C consists of disorders marked by anxious or fearful behaviors. Each of these clusters contains several distinct disorders which can vary in severity and impact on the individual's life. Understanding the key traits and symptoms of these disorders is essential for providing appropriate treatment and support. However, it is also important to remember that personality disorders are not static and can change over time with the right interventions. One of the most well-known personality disorders is borderline personality disorder. Individuals with borderline personality disorder experience intense and unstable emotions, relationships, and self-image. They may engage in impulsive behaviors such as substance abuse or self-harm and experience a deep fear of abandonment, which can lead to extreme efforts to avoid real or imagined separation from others. The mood swings experienced by individuals with borderline personality disorder can be intense, ranging from extreme feelings of emptiness and sadness to periods of anger or irritability. These emotional extremes can make relationships difficult, and individuals may often feel misunderstood or rejected. Treatment for borderline personality disorder typically includes psychotherapy, such as dialectical behavior therapy, which helps individuals regulate their emotions and build healthier interpersonal relationships. Another personality disorder in Cluster B is antisocial personality disorder, which is characterized by a disregard for the rights of others and lack of empathy. Individuals with antisocial personality disorder may engage in deceitful or manipulative behaviors and often show little remorse for their actions. They may violate societal norms and laws, engaging in criminal activities or other behaviors that harm others without feeling guilt or responsibility. In addition to these behaviors, individuals with antisocial personality disorder may struggle with maintaining relationships or holding steady employment due to their inability to connect with others emotionally. Treatment for antisocial personality disorder can be challenging, as individuals with this condition may lack motivation to change their behavior. Therapy, particularly cognitive behavioral therapy, can be helpful in addressing some of the underlying thought patterns that contribute to these harmful behaviors. Histrionic personality disorder is another condition in Cluster B, and it is characterized by a pattern of seeking attention and being excessively emotional. Individuals with histrionic personality disorder may feel uncomfortable or unappreciated unless they are the center of attention. They often use their appearance, charm, or theatrics to draw attention to themselves and may become upset if they are ignored. Their emotions can be exaggerated and shallow, and they may struggle to form deep, meaningful relationships due to their tendency to seek constant validation from others. Treatment for histrionic personality disorder often involves therapy, such as cognitive behavioral therapy, which focuses on helping individuals understand the root causes of their behavior and develop healthier ways of interacting with others. Narcissistic personality disorder is also in Cluster B and is defined by a grandiose sense of self-importance, a need for excessive admiration, and a lack of empathy for others. Individuals with narcissistic personality disorder may have an inflated sense of their achievements and abilities, and expect to be recognized as superior without commensurate accomplishments. They may exploit others to achieve their own goals and have difficulty recognizing or caring about the feelings of others. Despite their outward confidence, individuals with narcissistic personality disorder may struggle with feelings of insecurity or vulnerability, and their relationships often lack depth or genuine emotional connection. Treatment for narcissistic personality disorder can be difficult because individuals may not see their behavior as problematic, but therapy can help them develop greater self-awareness and improve interpersonal relationships. In Cluster A, one of the most common personality disorders is paranoid personality disorder. Individuals with paranoid personality disorder tend to be excessively suspicious and distrustful of others, even in situations where there is no evidence of harm. They often interpret benign actions or comments as personal attacks and may hold grudges for long periods of time. This constant state of suspicion can impair their ability to form close relationships and can lead to social isolation. People with paranoid personality disorder may appear aloof or guarded, and they may avoid sharing personal information with others due to a fear of being betrayed. Treatment for paranoid personality disorder usually involves psychotherapy to address the underlying distrust and help individuals develop healthier ways of interacting with others. Schizoid personality disorder, also in Cluster A, is characterized by a lack of interest in social relationships and a preference for solitary activities. Individuals with schizoid personality disorder may seem indifferent to the opinions of others and often have difficulty expressing emotions. They may appear detached or aloof, and their social interactions are often limited to necessary or practical situations. While they may not experience the same level of distress as individuals with other personality disorders, their inability to connect with others can lead to feelings of loneliness or isolation. Treatment for schizoid personality disorder may focus on helping individuals develop more meaningful social connections and improve their emotional expression. The final disorder in Cluster A is schizotypal personality disorder, which is characterized by odd or eccentric behavior, as well as difficulties in forming close relationships. Individuals with schizotypal personality disorder may display unusual beliefs or thinking patterns, such as magical thinking or superstitions, and they may have difficulty understanding social cues. Their behavior may appear strange or eccentric to others, and they may struggle with maintaining friendships or romantic relationships. Despite these challenges, individuals with schizotypal personality disorder often do not experience the same level of distress as those with other disorders. Treatment may include psychotherapy, which can help individuals address their social difficulties and learn coping strategies for managing their eccentric behavior. In Cluster C, the most well-known personality disorders are avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. Avoidant personality disorder is characterized by feelings of inadequacy and a fear of rejection or criticism, leading individuals to avoid social situations or relationships. They may have a strong desire for acceptance but fear being judged or humiliated. Dependent personality disorder involves a pervasive need to be taken care of, leading to submissive and clinging behaviors. Individuals with dependent personality disorder may have difficulty making decisions or taking initiative and may rely heavily on others for guidance. Obsessive-compulsive personality disorder, which is different from obsessive-compulsive disorder, is marked by a preoccupation with orderliness, perfectionism, and control. Individuals with this disorder may become excessively focused on rules, details, and schedules, and they may struggle to delegate tasks or work collaboratively due to their need for perfection. Treatment for personality disorders often involves psychotherapy, which is designed to help individuals understand the underlying causes of their behavior and develop healthier coping mechanisms. Cognitive behavioral therapy is commonly used to treat many personality disorders, as it focuses on identifying and changing negative thought patterns that contribute to maladaptive behaviors. Dialectical behavior therapy, which focuses on emotion regulation and interpersonal effectiveness, is particularly helpful for individuals with borderline personality disorder. In some cases, medication may be prescribed to help manage symptoms such as anxiety or depression, but medication is typically not the primary treatment for personality disorders. With the right support and treatment, individuals with personality disorders can learn to manage their symptoms and lead fulfilling, meaningful lives. Personality disorders are often misunderstood and stigmatized, but they are treatable conditions that can improve with appropriate intervention. Early recognition and treatment are key to helping individuals with personality disorders develop healthier relationships, manage their emotions, and lead fulfilling lives. By providing compassionate, evidence-based care, mental health professionals can play a critical role in helping individuals with personality disorders achieve recovery and live more balanced lives.